All right, everybody, welcome. Welcome to another live episode of the Compliance Guy. As always, I want to say thank you to each of you who are tuning in, logging on, and hanging out with me and my special guest as we discuss the latest in regulatory compliance, health law, operations, and information that impacts you as a healthcare professional. Before I introduce my very special guest, and we're going to have so much to talk about, and I'm so excited. Today, we're talking about, and I do want to say I'm turning on the chat feature. So y'all send us your comments, questions, concerns, and we're going to address them. So today, we're talking about the medical debt crisis in this country. And the fact is, it's much worse than what you and really until I started digging into this thing, what I believed it was. One of the reports I was looking at is the Stanford Institute for Economic Policy Research, who indicated that the nationwide medical debt estimate is probably larger than 140 billion with a B. 140 billion dollars. And I think one of the biggest points to this discussion that we're going to have is the fact that medical debt was highest among individuals who lived in the South, in zip codes in the lowest income deciles, and became more concentrated in lower income communities in states that did not expand Medicaid.
Mm-hmm.
This again speaks to the socioeconomic divide in this country and the need to close the gaps. This is unsustainable. And medical debt should not be the reason people cannot pay their rent, put food on their tables, or ensure their vehicle is in working order. So before I get to my really special guest today, who I'm so excited because he wore a hat. Now look, I'm breaking some of the rules, but I do have on my doctor's management. I do have that on. But before we get to talking with Jared Walker today, I want to quickly look at a couple of the numbers, Jared, because I want us to kind of talk about these. Okay. So nationally, 17.8% of people with credit reports as of 2020 had medical debt in collections, and 13% had accrued debt in the prior year but were not yet in collections. And of those who had medical debt, the average amount was $2,424 last year. So these findings are roughly in line with previous Census Bureau estimates. So I think that's important. But here's the thing that I wanted to address. The South has the most people with medical debts, or 23.8% of all residents, and the largest average amounts past due as of 2020. The Northeast, where I know you just were up in New York, had the lowest debt loads with 10.8% of individuals with credit reports in arrears and the smallest unpaid tabs. People living in low income areas owed the most, while those residing in high income regions owed the least. I'll get to some more of these stats in just a little while, but you know, here's the question, right? Because we could get into price transparency and all these different things. So the question becomes, what can be done about this? Well, simple, but not so simple. Jared Walker, who's the founder of $4, is joining me on the show today to discuss medical debt crisis and what he and his nonprofit are doing to literally crush medical debt and help people live without the continuous threats from collection agencies. So, Jared, it's so good to see you. It's so good to be live with you on all these different platforms. I know we've got people chiming in. We are we're starting to get some comments already, but you know what? I'll get to some of those a little bit later. Jared, first and foremost, man, I just want to say it's such an honor and such a privilege to have you on the program with me. You and I have had a lot of opportunities to connect We've had a lot of conversations while we were both in different parts of the country. We share some mutual friends. And before I go any further, I'm going to do something that could potentially get me fired, but I have to do this. I just have to do this. That is for Eric Rubenstein and Jean Marie. Thank you guys so much. Love you guys. Can't tell you how much I appreciate it. It just arrived in the mail today for the Kiss End of World tour that Eric and Jean Marie have been traveling around the country to do. But
there you go.
Let's get serious, because this is a serious issue, and this is something that we need to really focus on, because people are hurting. And I know your charity is really doing a tremendous amount to help people who are in crisis, who are in desperate need of debt relief tied to medical bills. And to date, you guys have crushed more than $10 million of medical debt. So, Jared, welcome, brother. Let's get this thing rolling.
Yeah, absolutely. Thanks for having me.
So I know you. Let's talk about what got you to the point of wanting to start a nonprofit charity, $4.
Yeah. So really, honestly, never thought I'd be here. And I started $4. Well, I originally had the idea in 2012 after watching my own family go through medical crisis. So my wife and I were sitting at home. She got a phone call, and her aunt had passed away from cancer. And then a few minutes later, I got a phone call. My cousin had gone into labor 7 weeks premature. Baby needed heart surgery to live. And it was just like both families kind of had, medical crises hit them at the same time. And I remember talking to my family about it. And the big, one of the big things was like, oh, how are we going to pay for it? So it just really infuriated me that was, the topic of that we were discussing. And I wanted to help people in that situation. So originally started $4 as actually kind of like a crowdfunding platform for people in the Pacific Northwest. And, we'd collect small reoccurring monthly donations. Every month we'd pool all the money together, and we'd pay off medical bills for people in the Portland metro community.
And it's really taken off from there, because you guys are nationwide now with your efforts. You're getting a lot of attention from different media outlets. You've gotten a lot of attention from healthcare leaders, around the industry. And I think it's great, but there's so much that has to be done, right? Because the coordination, getting staff together, getting donations, getting people to understand the mission, to align with your vision, that's not always an easy thing to do, right?
Yeah, no, it's a lot. That model that I kind of just described, like, kind of a crowdfunding model, is really, we've completely changed since then. And we're now, enforcing hospitals' charity care policies and trying to, expand the impact that we have. But yeah, we've been overloaded with need because, like, as the stats say that you read earlier, it's like there's no lack of need here. It's just, how do we meet the need? How do we help these patients?
Yeah. You bring up an interesting point, right? Charity care. And I think there's a lot of misperceptions with charity care. How do you qualify? What are the requirements? What if while you're waiting to qualify, you're making payments, and then you qualify? What happens? And have you found that a lot of hospitals that offer or say they offer charity care aren't really truly standing behind what it is that they're supposed to be offering?
I would say that hospitals don't make it easy to know what charity care is, and they don't make it easy to access. And that's kind of across the board. So I don't know if that answers your question, but I think that um, I think that a lot of them have this idea because that's one of the main questions I get. People are saying, "Oh gosh, these hospitals must hate you," like what are you doing? And they don't say that, they don't say, but there's also, federal law saying that they have to, you know, apply these charity care things. So it's this weird thing. I'm still trying to figure that out, to be honest.
Yeah, it's part of the game, right? And there's
Mhm,
unfortunately a lot of politics that are involved in healthcare, unfortunately. And we can broach that topic as we kind of go on, but let's talk about the hospitals, right? Because you're right, there are federal laws in place. Because when a hospital takes write-offs, or when a hospital is claiming charity care as part of their losses at the end of a year, or their tax credits, or whatever it is that they're filing for, you know they need to be able to substantiate those write-offs or those claims by showing that they have truly offered that care, and that they have people, that they've allocated that care to people. And I think you're right. Obviously, the hospitals themselves, especially for profit organizations, sometimes the not for profit organizations, they don't make it easy for people to qualify,
mhm.
and a lot of people don't understand, especially, when you start getting into the lower income, groups, where there's a lack of education that's available, there's a lack of will to provide them that education, and it's like they just start falling through the cracks,
Yeah.
and nobody's paying attention to them. And I think, from my perspective, and I want to get your thoughts on this. you know Irrespective of where you live, the color of your skin, your nationality, your orientation, whatever it is, everybody has a right to quality health care at an
Mhm.
affordable cost. And when the costs exceed what it is that people can afford, they need to have mechanisms in place to allow them some of that relief. And we've not seen that. And that's the reason why $4 is so critical right now.
Yeah. Well, thank you. I mean, I think there's this whole thing, we say, like, when someone has a medical crisis, they shouldn't have to have a financial crisis at the same time. And that's, it's just kind of how the system is built, unfortunately. Like, that's just how it works. And you know, when people have that, they're going through chemo, they're recovering from a surgery. Um, I can promise you that the thing that's not at the top of their mind is, oh, let me fill out this, big application and find all my proof of income and stuff. It's like, so like when you say, yeah, fall through the cracks, like there's so many people um, that just need an advocate. They just need someone to help them out through this time. And it is. I think it's definitely by design that it's not easy to find, easy to access, because people know that. People know, like, that they're gonna fall through the cracks.
Yeah, you know, you're right. And as a former hospital administrator, as somebody who's worked in hospital systems for a lot of my professional career, having to explain to somebody what a debt to income ratio is, and how we calculate it, and how we use a sliding scale, and all these different things. These are some of the reasons why I left hospital administration, because
Mhm.
people need an advocate. And what people don't understand is it's not just the patients that are suffering with this, it's the physicians as well. And physicians are having a hard time. you know Here's something real quick, if we could pause on that, because we're getting a ton of comments, and I want to share some of these. And this is what I love about you know my audience, the people that are tuning in. These are educated, well informed people who want to see the right thing done at all times. And this is a critical point. And I know at least one of my chuckleheads is out there listening today, Eric Rubenstein. But, we've talked about this, right? And Medicare Compliance One says, Sean, can you talk about the fact that uninsured patients are often billed retail,
Mm-hmm.
while insured patients are associated with payers who have negotiated the lowest rates? This goes one step further, okay?
Mm-hmm.
And this goes to the price transparency rule. And this is the reason why these price transparency tools that are being created by companies that Jordan Johnson works for, like OncoSpark and some of the others that are out there, they're so critical. Um, you know, Price transparency falls under 45 CFR Part 150 subparts B and C. Don't ask me how I know that, but somehow it just popped in there. And the price transparency, went into, hey, you're setting the mood for us, my
Dude, I
friend. All
just got
right.
it, man. I just hated that. Hated that.
That's all right. We're good. But look, here's the fact, right? Price transparency, we're going to see more of this go into effect in 2022, January 1st to be precise.
Mm-hmm,
But the
mm-hmm, mm-hmm.
thing that bothers me the most, and if you've heard me on prior podcasts, if you heard Jordan and Eric and I on Chuckleheads talking about this, I want somebody on Capitol Hill to explain to me why the insurance companies were granted a 6-month delay until July of 2022 to come into compliance with the price transparency rule. Now, I spent a lot of time on DC. I know a lot of Congress people, and I will tell you, they could spin this thing like a tilt-a-whirl. But I don't want it spun. I want the real answers, right? Because you need these answers, Jared, because this is what you're advocating for. We're advocating to be able to get patients relief of their medical debt. And we can
Yeah.
go further into price transparency in just a little bit, but go ahead, give me some of your thoughts.
Well, gosh, I mean, I'm gonna flip it a little bit because
Yep.
I get um this charity care law has been around for over 10 years, right? Uh, nonprofit hospitals have to have financial assistance or charity care policies to prove to the IRS that they're providing enough community benefit to justify their nonprofit status, right? And we're 10 years after that, and still nobody knows about charity care. There's still many, many, many nonprofit hospitals that don't have their applications online, that don't have their charity care policies online. We still have to fight and. So when I see all this price transparency stuff, which I love, and I know that there's a huge thing in LA going on right now that have all these celebrities around talking about power to the patient, and I love it. But I get discouraged thinking we're a ways off before these hospitals are going to be posting their prices, because I've seen it with the charity care stuff.
Yeah.
It's like we're going to be fighting this for a long time, and I don't know. Am I crazy? Is that how pessimistic is that, Sean?
Well, I don't think it is, but here's one of the things that irks me, right? And Jordan Johnson and my other good friend Terry Fletcher and I were going back and forth on this today on LinkedIn, right? Because I posted about price transparency and the rules and what it requires for compliance. But here's one of the things, and I don't think you're being pessimistic. I think you're spot on. Until people shine a spotlight on them, and by the way, we've let Fox News, MSNBC, CNN, NBC, ABC, CBS, all of the news outlets, we have notified every single one of them today about this podcast and having you on in the importance of bringing attention to this serious issue, because it hurts me to see my fellow citizens hurting. And it hurts me to know that there are people, simply because they are from a lower income bracket, they are less, they are provided less in the way of information.
Mm-hmm.
They're paying the highest rates. They're
Mhm.
paying more than what somebody like myself, who's on an insurance program that, to Medicare Compliance One's point, has negotiated these much lower rates. And
Yeah.
that's a significant disparity. But here's what it says. For plans and insurers that are subject to CMS's enforcement authority and do not comply, meaning comply with the price transparency, they may take, meaning CMS, several enforcement actions, including requiring corrective action and or imposing a civil monetary penalty up to $100 per day. Whoop-de freaking do.
That's what I've been saying, because it's like, yeah, hospitals just gonna be paying the
I mean, if
the
somebody's,
fee. Like, it's easier for them to pay the fee than it is to change it,
I mean, $100 is one Tylenol at a hospital,
Yeah.
right? So all I have to do is give one person a Tylenol each day, and I'm paying my $100 fine. I mean, look, this is a serious problem, and we need Congress to listen to people like you. We need them to give you as much attention as to what they're giving the lobbyists from big pharma, the lobbyists from the hospital corporations, the lobbyists from the insurance companies. You're working as a nonprofit, and you're working on behalf of the American people who are absolutely getting crushed right now with medical bills
Mhm.
in a time where we're facing the highest inflationary rate that we've seen in 30 years. We're facing supply chain demand issues, which is a whole other debacle. Um, we're facing a wider gap now between the political parties than we've ever faced. And if there's one issue that doesn't need to be politicized, it's
Yeah.
healthcare.
Yeah, absolutely. I mean, I'm getting tagged in this one all day. This one's been the 50%, the Forbes one, 50% of Americans now carry medical debt. It's just crazy. It's craziness. Yeah, it's definitely, yeah,
Yeah,
that's why we exist.
yeah. I
This
don't
is the
know.
problem.
I don't know. Maybe someday, maybe I don't know. Maybe I'll run for Congress. I don't know. I don't think anybody would vote for me, but we'll see. Maybe one day.
Yeah,
Not saying
one year.
anything, but maybe one day. Maybe one day. But here's the thing. So let's talk about charity care, right? Because the hospitals are still not posting what they're supposed to be posting online. They're still not making it readily available. They're still not offering it up front when they know somebody is incapable or, you know, underinsured, meaning
Yeah.
incapable of paying their bills because they're
Mhm.
underinsured or not insured. You've had some success with going after charity care, right? With the hospitals. Can you talk about some of the advocacy that you've done on behalf of patients?
Yeah. So, I mean, in 2019 is kind of when uh, we started with this charity care stuff. So I had an attorney on my board say, "Hey, we should try and enforce these charity care policies." And I, like everybody else in the country, was like, "What the heck is that? What is charity care?"
Right.
So we went and found a handful of patients that we knew had outstanding medical bills. We filled out all the paperwork for them. We sent it in. We got over $1 million in medical bills waived without really even trying. Just word of mouth, you know, local organizations connecting us to people, and it was like I realized this is a big deal. And over the course of the last 2 years, I had just been shouting it from the rooftops, like why aren't people talking about this? Talked to a whole bunch of journalists and news outlets and news stations and whatnot, and nobody really wanted to cover it. And so I thought that was super interesting. They all just wanted to talk about surprise medical bills or whatever. And so finally I got on TikTok and I told people what charity care was. So posted a minute video that just said, "Hey, this is what charity care is. This is how you look it up. This is how you see if you're eligible." And that video has, I think, now been seen close to 40 million times. And it's just like it just popped. Like people, it just shows you how many people needed that information. And um, from then, we were this tiny organization that was helping people in the Pacific Northwest. Uh, we had a little web tool that showed people if they were eligible for charity care, but we only had, a couple hundred hospitals on there plugged in. So the idea is to create a web tool that you could put in your financial, or your gross annual income, your household size, what hospital holds a debt, and then it would tell you what you're eligible for according to your hospital's policy. So we organized a group of 50 volunteers earlier this year, and we captured the financial assistance policy data for every hospital in the country, and that is now working. In the last 3 months, we've had close to $200 million in medical bills submitted through our website for patients just looking for help. And now we are trying to figure out what the hell we're going to do with all that because we need to get rid of it, but we got to build some capacity first.
Yeah. So great question from Pan Vanderbilt. How does $4 identify patients in need? So obviously people are submitting their bills, but once somebody submits their bills and they identify that there's a need, how does $4 make that determination on who they're going to help and how do they prioritize?
Yeah. So we do first, most people hear about us through social media, and then partner organizations. And honestly, it's like we're trying to keep awareness to a minimum right now because we've gotten so much attention. But
Right.
Once someone completes the eligibility screener, which is that web tool I was talking about, if they're eligible, then they're then sent a application that we created. So it's like a digital version of what the hospital is going to ask you. Who lives in the household, how much money do they make, proof of income, and all that. Patient will hand that over, and then we'll look it over, submit it to the hospital. We'll fill out all the paperwork, and then after a few weeks, we call the hospitals and we check in and advocate from there. And as far as like how we deal with them, it's first come first serve. We do have we try to get people that are just outside, like if they are closing in on that 240-day magic number of when people aren't eligible anymore, we try and push those through. But right now the reality is we just have thousands of applications coming in, and we're trying to get to them all as fast as we can.
So, and I know you are because we've had these conversations. So when you say the 200, when somebody's approaching the 240 days, it's 240 days for what?
So the IRS has identified 240 days as being a reasonable amount of time for hospitals to give you to complete your financial assistance paperwork, and that is 240 days from the day you get your first bill. So the day you receive that first statement, the clock starts ticking. You have 240 days. Probably the most popular question is like, well, what happens if my bill's in collections? And that is, depends. but it's interesting though, and I know we've talked about this, but these hospitals, they'll send you to collections after 120 days. So people get this collections notice, and you see collections and you think game over. There's nothing I can do. In reality, you have 120 more days to fill this out. The hospital can take it out of collections just as easily as they put it there. So we've gotten millions of dollars in medical bills that have been waived that were, in collections.
And I think that's such a critical point, right? Because remember, when somebody is referred to a debt collection agency or to a collection agency, whatever you want to call them, right? They automatically begin reporting you to the credit bureaus.
Mm.
If you file your paperwork within that 240 days and the hospital pulls it back, by law, they have to remove that from the credit bureaus.
Yeah. We've had tons and tons of people, reply back with, "Oh my gosh, my credit just jumped, X amount." So And there are, I will say this about the hospitals right now, at least I'm in the Pacific Northwest, a lot of them, and I know that a lot more hospitals are moving towards this. They don't send you to like credit reporting agencies right off the bat. So the like credit issue is becoming less of an issue, but at the same time, after that 240 days, then that kind of goes out the door.
Unless you live in Mississippi where Jordan is, they don't send you to a collection agency. They just sue you.
Yeah, there's a handful of states that's got some issues for sure.
I mean, did you see that? The hospital in Mississippi suing
Yeah,
80 of their own employees frontline workers, man, who
yeah.
needed medical attention after caring for sick people during COVID. They got sick themselves, needed medical attention, ran up a debt with the hospital, and then the hospital is suing them. I was like, wait, this has to be a joke, right?
Yeah, this is a news story that I've wanted to break a while, but again, I'm trying to fly under the radar. But I have had a significant amount of nurses, hospital people that work at hospitals, and they reach out and say like, I'm nervous to do this. I'm nervous. Like, can I apply without my employer knowing that it's me? I work for the hospital, kind of thing. And it's just heartbreaking because it's like these are the employer.
These are our frontline workers. These are our heroes.
Yeah.
Listen, I know you want to fly under the radar, but you know what? I don't mind flying high enough that somebody's going to take a shot at me, and I'm okay with it because you know what? I'll always tell it the way it is. I'll give the facts and I'll tell the truth. Frontline workers, our healthcare professionals, these folks should be off limits. These
Mhm.
are the folks that have given of themselves, they've given selflessly, they've put their own families in harm's way to be able to live up to the Hippocratic oath if you're a physician, to live up to your nursing oath, to do no harm to the patients. And at the end of the day, you know what? These hospitals, these health systems, they should not be punishing their own employees for taking
Mhm.
care of the patients that have made these health systems rich. I don't mind
Yep.
saying it. You don't have to say it, but I'll say it.
Nah, I mean, I'm fine with saying that. I'm saying that I've wanted to because I have so many of these that have reached out, and I'm like, there's a journalist out there that wants to write a story about this because yeah, it's just not right, and I think that'll come out once I can breathe again. I just
Well,
don't because anything that happens with dollar four, the kind of social media and the media pops that we get, it just brings on thousands of patients. So we're trying to catch up on our current
yeah.
backlog.
Well, and I think that brought up another good question from one of the viewers. Do volunteers help with getting the application submitted and processed?
Yeah. So we actually our goal is to get 100 trained patient advocate volunteers by the end of November. We've got about 35 right now. So we do trainings once a week with patient advocates, people that are going to be filling out this paperwork, calling the hospitals on behalf of the patients, doing everything to try and get rid of the medical bill. So yeah, volunteers are a huge part of Dollar Four. Education is a huge part of Dollar Four. I don't want to be an organization that forces you through the dollar four pipeline. We want to empower patients and make sure that if someone needs us to do this work for them and hold their hand and advocate for them, we'd love to. At the same time, we want to give people all the tools necessary for them to do this themselves. So we do a lot of open kind of webinar type things where people can come in and learn how to crush their own medical bills.
Absolutely. And I think that's so important, right? Because it goes back to what we were saying before with regards to the socioeconomic divide that exists. And it's giving people the education, giving them the tools and the know-how and the ability to be able to become self-sufficient, to be able to, stand on their own 2 feet so that the next time something like this comes up, they can advocate for themselves, and they can
Mm.
be armed with everything that they need, and that reduces the influx for $4, and it allows it to open it up to new people who need the help.
And those are, I mean, those are the coolest stories that we have. People saying, "Hey, I hopped on your Zoom, last month, and I just got my approval letter. I got 100 grand waived for my mom." It's like people that can take this info. Every single person in the U.S. knows someone that is struggling to pay a medical bill. It's just what it is. Like, there's not a single person that doesn't know someone that has a medical bill that they're trying to pay. And most people, 50%, as what Forbes saying, have their own medical bills. So it's like, I want people to be able to get on these calls, learn how to do this, because it's going to happen to someone that they love, and they're going to be able to come in and take that on. So I think that's, if we can create an army of patient advocates, people that know what to do when you get that medical bill. If every patient's asking for charity care, what's the charity care policy? What's financial assistance policy? Where's the application? Where's that itemized bill? All of these things that we all know, like, this is how you fight it. I think that we can create some real change.
How does somebody qualify to be a volunteer?
So, $4, we do, you go to $4.org, hit the volunteer tab, and you can sign up. And then that will be like, we'll do the volunteer onboarding a couple times a month. And if you like what you hear, then you can sign up for the patient advocate training, which is a little more in depth. We do a background check. We have you sign a privacy policy. There's a little bit of sensitive information that's shared back and forth, and then you do the training, and you're on your way.
There you go. And there's the $4 website.
That's right. So yeah, volunteer tab, and then people can sign up there. They can also donate right there as well.
We'll get to that in just a minute. I know some of the most immediate needs. There it is. Volunteer with $4. Now, let's talk about donations for a minute, because this to me is absolutely incredible. Is it true that for every $1 donated, it helps to eliminate $50 of medical debt?
That's actually false. It is $53 right now. Last time I checked. So, yeah.
You're supposed to say, yeah, man. It's actually 50. God, you're telling me I'm wrong. I'm false.
No, dude, you're right. You're always right. We've been able to multiply the dollars. I mean, you think about what we do. Like, we've created some cool tools for people to use. We've been able to automate a decent portion of this. We have staff and volunteers that know what they're doing, know what to say to the hospitals, know what to ask for, know how to find the policies. And so far this year we've turned every dollar donated into 50, and that number could be 500. That it could be a significant increase. We're just getting started.
And I think that's why, look, even though I'm a compliance guy and I love to talk about regulatory compliance and health law, and people are probably, why are you talking about charities? Because of the lack of compliance that exists within hospitals and health systems, with making sure that they're doing what they have to. Jean Marie Loria asked the question, and it's another great question. If I don't have time to volunteer, what else can I do to help?
So spread the word, donate. I mean, we have relied on small reoccurring monthly donations, and people sign up for $5-10 a month. That's wonderful. Join the giving community. Sign up for more. You can sign up for as much as you want. Introduce us to people that might be passionate about our work. Spread the word. We're pretty big on social media. We're on Instagram, Twitter, TikTok, So
Absolutely.
um, the other really cool thing is like if you use this info, if you get medical bills waived for someone that um, share the story. We want to celebrate with you. Like that's another really fun thing about it is celebrating the wins.
Yeah, and I think awareness is the biggest thing, and I think the more people at the hospitals that are in the financial departments that are responsible for this, that are aware of your organization. You said build an army. Kiss has their army, right? The Kiss army.
Yeah.
We need the $4 army. And I think you've already laid the groundwork as the general to kind of start building your platoons and getting people on board, and that's what it's going to take.
Yeah. I'm pretty excited for this next year. I just was like you said earlier, I was in New York. Been talking to student at NYU trying to do a $4 club on college campuses, get student volunteers, and I think the army's gonna be coming here real quick.
Good. So you said you're excited about 2022, and I know you've been generous with giving me your time. So I want to start to kind of wrap things up so that you can go have dinner. I know this morning you hopped on a train from New York down to DC. I've done that myself a couple of times. Um, let's talk a little bit about what's in store for 2022. Let's talk about your goals, your board's goals, the goals and mission of $4 moving forward in 2022.
Yeah, so we've got some pretty bold goals, but the goal is for 2022, and I haven't actually said this anywhere yet, so this is the first time. We're gonna get rid of $100 million in medical bills in 2022. That's the goal. That's a huge jump, obviously. And right now, I'm kind of running around the East Coast and a few other spots later this year to try and raise the funds to be able to do that. So we're gonna do a handful, like I've been saying throughout this podcast, is like we're trying to stop the media from promoting what we're doing, just so we can take a breather. 2022, we're going wild. We're gonna take every single interview, every single uh, chance that we get to get the word out. We're gonna go for it. We've got a handful of journalists and people we've been talking to about stories, and so I think there's gonna be you're gonna hear a lot more from us, and we'll be crushing a lot more medical bills. Technology is another big thing, furthering automations and just trying to get this more efficient.
Absolutely, because efficiency is what's going to keep you guys moving forward and keep you on track to hit that $100 million in 2022. I think that's just so exciting, and I'm grateful that you shared that information here with us today. Um, so I know you're down in DC. I know you've got some big meetings planned from DC. Where are you headed to?
Yeah, meet with a couple foundations. I've had uh, some donor meets. Just people that have been giving or involved in some way over the years, and just kind of exactly like showing them that vision, saying, "Hey, this is what we're doing." In New York City, I was in like an Accelerator program there, and was able to meet with some pretty great people. So yeah, just running around.
For our listeners that don't know what an accelerator program is, can you quickly share that with us?
Yeah, so this is a nonprofit accelerator. I mean, it's kind of like Shark Tank for nonprofits. They fly in all these mentor type people, so heads of foundations, CEOs, nonprofit leaders. Nonprofits go up. So there's 12 of us in this accelerator that were chosen for it. You kind of pitch your idea, and then those mentors want to meet with you. You get little one-on-ones and small breakouts with them, and you're just getting a ridiculous amount of information and connections, and it's awesome. And then 24 hours later, all of those people leave and a new group comes in, and you just do that for a few days, and it's a little exhausting, but it was really grateful to be a part of that. So that was the first meeting. We do the same thing in February and then again in May. So it's a thing.
Well, I'm sure you're going to crush them.
$4 holds up. I was, I'm in the room with these other incredible, I was kind of nervous. I was like thinking, gosh, you just get a little insecure or imposter syndrome or whatnot. You're thinking, gosh, what am I doing? But it's cool that they even considered us for it, like as one of these top nonprofits that are.
But that's what keeps you humble, right? And I tell people all the time, the day that I lose the butterflies doing what I'm doing, going into courtrooms, arguing and advocating on behalf of my hospitals and health system clients and physicians, doing podcasts, the day that I lose those butterflies, I'm in big trouble.
Yeah,
So, that's what keeps you sharp. That's what keeps you honed in. And I think that's what's going to continue to keep $4 on the front burner and getting the recognition that it deserves. So in closing, Jared, any final messages that you want to put out to our listeners and our viewers today?
Check us out. Help us spread the word. Donate $4.org. Sign up for a little donation. Monthly. It would mean a lot. And I think I feel like it's finally like it's like happening for us. We're getting a lot of attention, and that's fantastic. We're just going to keep riding that wave and encourage people to keep sharing what we're doing. It's important. It's not just like, hey, promote my stuff. Like, it's not like that. It's really, you can make a huge impact in someone's life. I was sitting at a bar the other night and I hear this guy say, oh, I had to go to the ER a couple nights ago. And it's like, I'm just a crazy person. So I hear that and I'm like, okay, well, I'm going to ask him a whole bunch of questions, but it's like, I'm going to get those medical bills waived for that bartender because I know that he qualifies. I asked him about his income and, he had no idea. Nobody knows. Nobody knows this exists. You'd be shocked at, a lot of people don't think that they're eligible and they are. So I just keep telling people, hey, this is a thing. Let them know.
Yep. So let me give just a lot in closing a couple of statistics that I think should drive this point home on how desperate the situation is for so many out there. So states that expanded Medicaid in 2014 saw a decline in the average yearly accrual of medical debt through 2020. That was 34 percentage points greater than states that did not expand their Medicaid rolls. Yeah. Medicaid is critical to the uninsured. Almost all income groups in non-Medicaid expansion states, folks, listen to this. They saw their medical debts rise annually between 2009 and 2020. The poorest communities were most affected. In 2020, they added $836 on average in new medical debt per capita, up from an annual amount of $630 in 2009. Folks, it may not sound like a lot, a couple of $100, but when you're in a low income situation where every single penny matters, $200 is a lot of stinking money. And the final thing that I'll leave you with is between 2009 and 2020, total medical debt in collections decreased less than reductions in non-medical debt. By 2020, individuals had more medical debt in collections than they had in debt collections from all other sources combined, including credit cards, phone bills, utilities. Come on.
Yeah. It's a thing.
That's going to be the hashtag for this podcast when it goes out to the platforms. Hashtag it's a thing.
It's a thing. The stats, It was what got me. I was reading some stats. This is in 2012, so these might be a little outdated, but gosh, they might even be worse now. It's like I remember thinking that the amount that people were declaring bankruptcy over, it shocked me. I thought it was going to be so much more, um, but it's exactly what you said. Uh, Single mom, kid gets cancer. If you get a few $1,000 for on medical bills, like it may as well be 100 grand. Like it doesn't, you know. Yeah, you shouldn't have to deal with that when you shouldn't. People shouldn't lose everything because they get sick, and it's just a crazy reality that we're in. So, anyways,
Yeah,
appreciate
and
you.
and especially coming through COVID over the last 18, 20 months now, and the fact that we're still in a pandemic. Hopefully we're starting to see the light at the end of the tunnel. Hopefully we can hold off on some more of these Delta variants and others that are coming about. But yet, Jared Walker of Dollar Four, I can't tell you how much it means to have you on the podcast with me, to spend your time after I know you've been traveling all day. You've been in these meetings and in New York and in DC and getting ready to run around and get this charity rolling. So, folks, again, make sure you get out onto the Dollar Four website. Again, it's dollar4.org. Get on there, volunteer, sign up, small donations. Every single penny helps. Let's crush this medical debt. Let's help our fellow friends, neighbors, family find a way to just start to breathe again. So, on behalf of myself, the entire team at the Compliance Guy Live, thank you to Jared Walker and Dollar Four for coming on the show today. As always, I want to say thank you to each and every single one of you that tuned in from around the country, whether you're tuning in, logging on. Thank you so much, as always, because I know there's always things that you could be doing that probably would be more enjoyable than listening to my voice. But I appreciate you. And until next time, folks, be good to yourself, but more importantly, be good to each other. We'll see you soon.